There we go.
Great, so our presentation is on bipolar 1 disorder. It is based off of the movie Silver Linings Playbook. My name is Maria.
I'm Alexandra.
My name is Kylie.
I'm Alexandra.
I'm Melanie.
In the movie, Pat experiences bipolar disorder 1. The etiology of bipolar disorder involves both genetic and environmental factors. Studies have shown a strong link between genetics and bipolar disorder as evidenced by twin studies, which show 90% heritability. In the movie, Pat's father's obsession with football and aggressive behaviors at the football games suggests that he might have an undiagnosed bipolar disorder. The American Psychiatric Association states that recent life stress is an environmental factor that may trigger a manic episode, and in Pat's case, discovering his wife's infidelity was that trigger for him. The neurophysiology and pathophysiology of bipolar disorder involves multiple mechanisms. There are genetic components, disruption in signaling pathways, imbalances in biochemical pathways, and neuroimaging findings showing reduced volume in areas of the brain such as the prefrontal cortex, temporal lobes, and anterior cingulate cortex. For therapeutic measures, it is a multidisciplinary approach including pharmacological interventions such as mood stabilizers or antipsychotic medications. Cognitive behavioral therapy has also shown good results for bipolar disorder, and it's important for patients to have supportive relationships in their lives. Here I attach the DSM-5 diagnosis and a quick movie clip. For the diagnosis of bipolar 1 disorder, manic episode involves 4 parts, each of which is highlighted in green. I also highlighted in yellow the signs and symptoms that Pat showed in the movie. Overall, it includes Part A, which is an abnormal and consistently elevated mood or energy for a certain amount of time. Then they have to meet 3 to 4 of the criteria under Part B, which include things like decreased need for sleep or racing thoughts. For Part C, their mood disturbance must be serious enough to impair social functioning, and for Part D, the mood changes cannot be due to substance use. If Parts A through D are met, it constitutes a manic episode, and bipolar 1 disorder may be diagnosed. And then here's a quick movie clip which shows Pat having a manic episode.
So for Pat's nursing care, that if we were his nurses, the nursing care that we would be able to provide him, we would adhere to institutional policies because these help guide safe psychiatric care, medication management, and discharge planning. We also have legal regulations such as HIPAA, which ensure his confidentiality and autonomy are respected. Ethical standards and client rights require nurses to balance safety with Pat's right to make treatment decisions, promoting dignity and trust. Economic factors such as insurance coverage and access to affordable therapy affect continuity of care, and nurses may even need to coordinate community resources to support his recovery. For cultural diversity, we can include his family dynamics and societal attitudes towards mental health and shape how Pat engages with treatment and the care team. As nurses, understanding these factors will help us provide the care that will ultimately support Pat's emotional stability, adherence to treatment, and social reintegration.
When examining the etiology of his disorder and stressors through his lifestyle, we can see biological, psychological, and environmental or social factors. We know that Pat was diagnosed with bipolar disorder. It can be linked genetically. It wasn't explicitly said in the film, but his father demonstrated signs of OCD and anger issues. It could, this demonstrates that mental illness may run in their family. There's psychological factors that contribute to this. Pat struggled with emotional regulation and obsessive thinking. There was this delusional belief that he adopted, that he can potentially win back his wife, his ex-wife, and there was environmental and social factors as well. Like we stated, there was marital problems. His wife's infidelity was a major stressor. Legal issues, for him, it was being institutionalized right after assaulting the man his wife was having an affair with, and family dynamics. Throughout the film, it was seen that his family did contribute to some of his behavior. And then we do have some stressors, which include throughout his early adulthood. Before this specific trigger, there was unaddressed mental health concerns that later on they were able to diagnose him with bipolar disorder, and then his marital conflict once again, and his reintegration into society after being hospitalized or institutionalized. After leaving the institution, he struggled with stigma. He was struggling to adapt to a medication routine and rebuilding those relationships. We have some protective safety factors that we see throughout the film. There's psychological, social, cultural, and spiritual. In the psychological aspect, Pat showed resilience and determination to improve, such as he was adopting reading, exercising, and attending therapy. On the social aspect, he did gather this good support system, such as his father, and then eventually we see Tiffany, that allowed him to engage in a structured activity, which was a dance competition, and this provided routine, purpose, and emotional expression. In the cultural aspect, we see his family rituals. They watch football together, and this provides a sense of identity and belonging, even though the father's superstitions and rituals were maladaptive, but they offered him a sense of control and connectedness. In the spiritual aspect, it was not in a religious sense, but Pat maintained a hopeful and a spiritual belief in finding silver linings, and this guided him through recovery. All right, now relating this to healthcare needs, we do see this need for continuity of care. We see that there's a consistent psychiatric care that Pat is provided with. He's going to a therapist, and then there's also medication management, which he struggled with, but eventually got a routine for himself. And there's therapeutic alliance. Pat and his therapist, they both shared a sports team allegiance, which helped with engagement. It kept Pat engaged in their sessions. His family education and support. His family needed to be provided with education about bipolar disorder to avoid enabling or escalating behaviors, and community reintegration, like I said previously. He needs some social skills training, vocational support, and structured activities to support his transition back into society, which dance was obviously a big one for him. Some strength in his case, he has strong family involvement. He was motivated to recover, even if he was at first misguided for the wrong reasons initially. Or I wouldn't say wrong, but they weren't consistent reasons. And then he was open to therapy and medication eventually. And then eventually he also learns to manage expectations and gain insight into his condition. Some deficits in this case, he was initially non-compliant with his medication. He wasn't taking the medication. His poor impulse control, and he had many episodes of mania. He was obsessive and delusional. He formed these thoughts regarding his ex-wife, and his family showed lack of full understanding of his cognition. The protagonist of the film is Pat, and he's in his early 30s, which this places him in the stage of intimacy versus isolation. This stage surrounds the individual's ability to form meaningful, committed relationship with others. Pat was attempting to rebuild his marriage, but he had difficulty reforming new relationships. This was due to the obsessive thoughts he had of rekindling his relationship with his ex-wife. He displayed mistrust and boundary issues that hindered intimacy. And moving forward, he was slowly beginning to connect with Tiffany, who also had emotional scars. Both of them shared vulnerabilities in which later they built a genuine bond. And Pat's bipolar disorder first interrupted or disrupted his ability to form and maintain intimate relationships. His condition led to emotional instability, impulsivity, and poor insight, which created barriers to intimacy.
For the nursing process, I created a really quick one which shows the assessment, which shows medication non-adherence, irritability, insomnia, and history of aggression. This led me to the following nursing diagnosis, which include risk for violence, disturbed sleep pattern, and ineffective coping. And for planning, I found that safety is the number one priority. Because of that, some of the interventions include medication education, encouraging rest, and close monitoring of symptoms. The evaluation of the patient will be positive if they show decreased irritability, insomnia, and increased adherence to medications.
So based off of the nursing process, we developed a nursing care plan for Pat. His diagnosis includes noncompliance related to insufficient knowledge about the regimen, as evidenced by non-adherence behavior. So this is due to him not taking his medications and not following through. So some expected outcomes that we have for him are: patient will demonstrate compliance with the treatment plan by attending appointments with his therapist and continuing with his medication regimen. So we will work alongside his mother and his therapist to make sure that he is attending these appointments and he is following through and is participating in them. For the assessment portion, we will identify the patient's current knowledge regarding his medication. So we will assess to see if there's any significant effects that the patient can be experiencing, or reasons as to why he is not taking them. We will assess the patient's interest in following a treatment plan, promoting autonomy for the patient, and we will assess the patient's beliefs about the treatment plan. Some interventions include tailoring the information to the individual patient and involving family members and other supportive people. So in this case, it would be his mother, his therapist, and Tiffany as well.
This movie helped humanize mental illness. Pat, which was diagnosed with bipolar disorder, and then Tiffany, which struggled with mental health and grief. Both were not reflections of stereotypes, rather than they were portrayed as fully human characters. Their human flaws, relationships, and growth helps audiences empathize with people living with mental illnesses. Another thing this movie did a great job doing is destigmatizing treatment. Pat, Pat didn't like attending therapy in the beginning, but in this movie, it is portrayed as a positive light, and the therapist, Dr. Patel, is seen as a culturally competent and supportive. Another important aspect of the movie was that it demonstrated recovery as nonlinear, which is more realistic. Pat had a couple of setbacks and emotional outbursts, but he was improving with support and effort.
So for if we're relating the movie to our real life experiences, Pat's experience with bipolar disorder reflected several of the lessons that we've learned about in our classes, from clinical observations in the DSM-5. An example of this is Pat's mood swings, his impulsivity, irritability, and periods of intense energy. This all aligns with the diagnostic criteria for bipolar disorder, and this also includes his manic and depressive episodes. And the movie did take some creative liberties to add dramatic effect. This is Hollywood, so they have to make it appealing to the crowd. So many of the core symptoms that they described are accurate, but the intensity of the emotions and rapid shifts in behavior are probably a little bit exaggerated, and unlike what I think we would probably be seeing on the regular in the clinical setting. I think that what we may see could be a little bit more gradual, with more variety of coping mechanisms. And this movie uses dance therapy and humor as part of Pat's recovery. And while these may very well be therapeutic in real life, the movie presented them in a less than likely way for real life. Like I said, everything's a little bit exaggerated because this is Hollywood, but they do have a lot of common things that overlap with the movie and real life. Overall, I do think that this movie is pretty consistent with the DSM-5 criteria and my own clinical understanding. I like that it reinforced the importance of empathy, support systems, and holistic care.
So, as for our overall evaluation of the movie, watching this film was extremely useful. It allowed us as the viewers to see the bipolar disorder through a different perspective and really see how it affects people throughout their activities of daily living and throughout their life. Not everyone experiences it the same, but they display signs and symptoms similarly. So we saw this through Pat and Tiffany. The film allowed us to see the growth and development of the character throughout the film. So it allowed us to see how they took different coping mechanisms and used it to their advantage to help suppress some of the symptoms that they were feeling by not taking a pharmaceutical approach. This film really just shows how anyone around us can be experiencing the same things in a different manner, and that it's totally okay to feel these emotions. This film would be useful to be watched for those that still have a negative connotation towards mental health illnesses, as it helps break the stigma behind these individuals. And then some NCLEX style questions. A nurse is caring for a client diagnosed with bipolar 1 disorder. The client's father also exhibits obsessive behaviors. This finding supports which type of etiological factor? The answer would be B, genetic and physiological. We discussed this earlier in the slideshow. And then for number 2, a nurse is teaching a group about biochemical changes involved in bipolar 1 disorder. Which statement by a student indicates understanding? The answer would also be B. The disorder is linked to an imbalance among multiple transmitters. And then for number 3, a nurse is discussing ethical considerations for caring for a client in a manic episode. Which nursing action reflects adherence to ethical standards? The answer would also be B. It's really important for us, like I mentioned before, that we respect their autonomy and that we try to make them as involved as we can into their care plan.
And then these are our references. Thank you.